I'd very much like to tell you about a condition called trigger finger. It's a relatively common condition affecting the hands. It affects all the fingers and thumb. And it's an illness to do with the tendons. Now the tendons bend the fingers up and down and they slide along in little tunnels. And in particular, there's a little mini tunnel here called a pulley. And what happens is as people get older, they develop a little swelling on the tendon. And as you bend the finger, that swelling comes out through the pulley, this little tunnel. And then as you straighten the finger, that swelling catches on the tunnel entrance and it won't release. And then they have to release it like that. And it hurts or it gets stuck and it can be a real nuisance. It's worse first thing in the morning. And as the day progresses and things get going, the swelling goes down, it's more easy. And it's, as I say, it's very common. Treatments include physiotherapy and a cortisone injection, and the cortisone injection can be extremely effective. Patients can get 6 to 9 months relief, and then it can be repeated. In fact, some patients are even cured by a single cortisone injection, so it's definitely worth having a try at that. For those patients where they continue to have a problem, then there's an operation, and traditionally the operation involves a cut in the hand. It's an operation I've done for many, many years, and it's a very successful operation. And you open up the pulley, this tunnel, so that the bump can slide up and down without catching on the entrance. And that incision is about 1 inch long, and it's usually stitched, and those stitches then have to be removed after a week or so. I've recently learned to do a new operation. I've been on courses learned to do this, and it's a keyhole trigger finger release. And what happens is we can make a tiny incision just at the base of the finger there, and using an ultrasound probe, and I use ultrasound a lot, can pass a keyhole knife and see it under the skin. All this is done under local anaesthetic in an operating theatre, and just release that tunnel so that you achieve exactly the same outcome as with the open operation, except you don't have to make a big skin cut. And not surprisingly, a little cut here has far less pain and limitation than a big cut in the palm. So much so that we can do several fingers at once if necessary, and some people have 2 or 3 fingers affected. You can even do fingers on both hands because they'll be able to use their hands pretty much straight away afterwards. They'll certainly be able to wash or dress the next day or the day after, be able to drive after 2 or 3 days. And generally the recovery is much quicker initially to get going. Patients still get tenderness and aching afterwards, and so the power gripping, that still takes a month or so to get back to normal, just like the open operation. But the big advantage is you haven't got this painful cut in your hand and the scar tenderness and the scar issues. Chances of infection are also much smaller because it's just a little incision which heals much quicker. So I'm very happy to recommend it. I think it's a terrific operation, and patients who've had it have been absolutely delighted. In fact, patients who've had both would never have the open operation again.